Do you work in healthcare? Do you think that you might be missing something in your digital healthcare landscape? Is your system frustrating you because you think it should do something, but you've been told that it can't? Do you think that there is some untapped potential in your EMR? Hi, I'm John Lee. I'm a practicing emergency physician. I'm also a clinical informaticist and have multiple Epic Analyst certifications. Because of this, I have a unique perspective on how our IT systems and EMRs can work with healthcare. My goal is to spread the word about what we can do with our digital systems, and I've created what I'm calling informatics shorts to highlight how I think we can improve how we use these systems. In my first video, I talked about how we are not fully leveraging the potential of our modern EMRs. In this video, I wanted to illustrate that point by talking about order sets. If you aren't familiar with them, order sets are a collection of orders that are commonly grouped together for a specific clinical scenario. This sort of grouping simplifies ordering and helps ensure key elements are not missed for a given clinical situation. If the patient is septic, an order set will ensure you get blood cultures and serial lactic acid testing along with the antibiotics. If you're administering blood, they will group a type and screen order with the transfusion and a follow-up blood count. If you are managing a diabetic ketoacidosis patient, frequent blood sugar checks will be grouped with the initial labs and the insulin drip. The concept of order sets has been around for decades. They were quite common even when we were all on paper records. In the past, they would be stacked in a bin, and the physician would select one, fill out some checkboxes, make a few edits, and sign it. In many ways, our electronic records make the process easier. For instance, we don't have to go searching for the right bin, and we don't have to physically go to a hospital unit to review the order set. But there are other opportunities that we don't fully leverage. Even though our advanced EMRs are far more capable than what we were able to do on paper, we often are satisfied just copying the paper content onto the computer screen. We don't take full advantage of the dynamism that a digital record can give us. Maybe the most common opportunity is the ability to show or filter content based on clinical data. For instance, a common antibiotic is cefazolin. It is given at a dose of 1 gram if the patient weighs 100 kilograms or less versus 2 grams if the patient weighs greater than 100 kilograms. On paper, you would have to write this all out and rely on the end user to choose the right dose. In our digital systems, we already know our patient's weight. Why do we ask our clinicians to look it up and hope they make the right decision? If a patient requires broad-spectrum antibiotics for sepsis or pneumonia, and there are 2 sets of choices based on the patient's penicillin allergy, you already have that information. Why are we making people look up the allergy and think about it? If you are an ordering physician and have a patient who is in pain and needs pain medication, the content can automatically change and prompt you for the pediatric dose for a 4-year-old, an adult dose for the 30-year-old, and even understand that you should still probably give an adult dose to the 180-pound athlete, even though he is only 16 years old. Why do we make physicians decide on weight-based pediatric doses versus adult doses on the fly? This isn't just a way to make order sets do silly EMR tricks. These may seem like small things, but our providers are already being constantly pestered. This sort of strategy can not only make physicians and other clinicians' lives easier, it will reduce some of the all-too-common human errors that we create within our healthcare system. We can guide clinicians without interrupting or annoying them. The guidance just happens. If you want to know more about order sets or how informatics can help fix healthcare, email me or connect with me on LinkedIn.